Hi, my name is Jacqueline Nguyen, and my disease is measles. Why does this problem exist in this society? In the early 1900s, about 12,000 people in the US were killed by measles, and most of them were under 5 years old. Most of them were affecting children, which became a very huge issue. Measles was also rampant in the mid-1900s, where there was an average about 500,000 cases and 500 deaths a year. Many kids were dying to an unknown disease where there was no treatment or no vaccine, and symptoms include fever, coughing, and rash all over the body, which is shown in the bottom right corner. How does this happen? Measles is caused by a virus that attacks the respiratory system, and it is also very easily transmitted and contagious through the air or by touching objects. It can also be passed on by a mother to her child. That is why it's usually recommended for mothers to get vaccinated as well. Any contact, skin to skin contact, or touching things will also spread the disease. Therefore, with no treatment, it can continue to spread. Where does this happen? It's historically been very rampant in the US in the 1950s and 1960s, where about 3 to 4 million people were infected a year. There was also an outbreak in 2015 where 98 cases at the amusement park, which was Disneyland in California. In 2014, there were other cases in different countries, such as the Philippines, which had a huge outbreak of 57,000 cases, and China had double that many cases. There were other outbreaks also seen in Brazil, Ethiopia, Indonesia, and Vietnam, and there is a chart in the top right to show you more cases. What are the risks for the community in the future? Measles can lead to very severe diseases such as pneumonia or encephalitis, which is the swelling of the brain. So it causes people to die by causing other diseases. So people usually don't die of measles themselves, but this is why vaccinations are recommended. And if people do not get vaccinated, the disease will continue to spread and can cause an epidemic all over the world. Unvaccinated people traveling could also spread the disease this way. What are the etiological factors? It's caused by a virus of the paramoxyvirus that attacks the respiratory system. And this mainly happens in kids who are not vaccinated for measles because parents are scared of the side effects, and mainly happens in kids who are under the age of 15. Anyone unvaccinated, though, can be infected, and that is why everyone is recommended to get the vaccine. It can especially be infecting for pregnant women as well as people with a weak immune system, and is also common in poor countries with bad healthcare, such as Africa and Asia. And the map down below shows parts where measles is very rampant. How to solve the problem. Strategy 1. Currently there is no treatment for measles, so this strategy focuses on not spreading the disease. There's only medication to reduce fever and pain, but measles will last around 2 to 3 weeks. And so in this case, people can isolate themselves and not go to social gatherings. They can also wear a mask to prevent transmission through air and refrain from touching objects to also spread the disease this way. Strategy 2 focuses on primary prevention described in public health, which recommends that people get vaccinated for the disease. Kids are recommended as well as adults to get vaccinated by the MMR vaccine, which is recommended in 2 doses for stronger immunity, especially in adults with weak immune systems. One historical example was the first case in which prompted a solution in 1954 in Boston, Massachusetts, where many students were infected by measles. Dr. Peoples and John Enders were able to isolate the measles virus from a 13-year-old student, and then John Enders and other colleagues were able to transform the strain of measles into a vaccine. Another historical example is in Africa when measles became an endemic in the 1970s to 80s, where about 1 million cases per year were being reported, and this caused routine vaccinations to be created by the World Health Organization. And a control program in Africa was created called Smallpox Eradication and Measles Control Program as well. And the introduction of the vaccination put measles rates very low. Public health in the future. What could be done to prevent this? According to the CDC, children that are 1 year old or higher should have 2 doses of the MMR vaccine, as well as adults. And the Mayo Clinic says we should promote herd immunity. And in my opinion, people should be more educated about vaccines and the side effects, because it is more beneficial to get the vaccine than to be getting the risk. And people traveling should also be getting the vaccine. Thank you for listening.